Hello friends, today I will show you health insurance. So welcome to my another video. So let's see health insurance definitions, how it works. What is health insurance? Health insurance is a contract between a company and a consumer. The company agree to pay all or some of insured person's healthcare costs return for payment of a monthly premium. The contract is usually a 1 year agreement during which the insurer will be responsible for paying specific expenses related to illness, injury, pregnancy, or preventive care. Health insurance Health insurance agreements in the US generally come with expectation coverage, including dedicatable that requires the consumer to pay certain health care costs out of packets up to maximum amount before the company coverage begins. One more co-payments that requires the consumer to pay set share of the costs for specific services producers. Key takeaways: health insurance pays most medical and surgical expenses and preventive care costs injured by the insured persons in return for monthly premium payment. Generally, the higher the monthly premium is, the lower the out of pocket costs are the injured. Virtually all plans have dedicatables and co-pays, but these expenses are now capped by federal law. Since 2010, the Affordable Care Act has profited ensures companies from denying coverage to patients with conditions and has allowed children to remain to their parents. Insurance plans you until the age of 26 year. Medicare dedicated and the children's or health insurance program. Our federal health insurance plans that extended coverage to older, disabled, and low income people. How health insurance work? In the United States, health insurance is tricky to negative. It is a business with a number of regional and national competitors whose coverage, pricing, and availability vary from state to state and even by country. About half population has health insurance coverage as as an employment benefit with premium partially covered by the employer. The cost of the employer is tax deductible to payer and the benefits to the employer are tax free with certain expectation for S corporations employees. Self-employed people, freelancers, and gig workers can be insurance directly on their own. The Affordable Care Act 2010, commonly called Umbrance, mandated the creation of a national database called Healthcare Government, which allows individuals to search for standard plans from private insurance that are available, where the cost of coverage are subsidized taxpayer whose income are between 100% and 400% of the federal preventive thousand threshold. But not all states created their own versions healthcare government that they are tailored to their residents. People over the age of 65 year and those with disabilities and stage renal disease are less qualify to receive federal subsidized care through Medicare, while families whose income are near the poverty level are eligible for subsidized Medicare coverage. Types of health insurance. Health insurance can be tricky to negative in the US. So, called managed care insurance plans requires policyholders to get their care from a network of disconnected healthcare providers. If patients seek care outside the network, they must pay higher percentage of the cost. The insurer may even refuse payment outright for the service obtained off network. Many managed care plans, for example, health maintenance organization HMOS and point of service plans, requires patients to choose a primary care physician who oversees the patient's care, makes recommendation about treatment and provide referrals for medical specialists. So this वीडियो कैन गोइंग टू एंडिंग. मिलते हैं अगली वीडियो में. अल्लाह हाफिज़.